a calculations about how many supply side hospitals, like, you know, primary, secondary healthcare to serve this 270 million. I think that's one of the challenges, and the pandemic actually in the last 2 years has been like quite a big stress test to the systems. I think everybody around the world is experiencing that. It's a really a big stress test. So yeah, I think if we're looking back, then the role of, say, like telemedicine is very popular in the past 2 years. People now understand that they can contact their doctors online and so on and so forth. And so there are a lot of there are a lot of changes, but still the challenge from the supply side is quite huge.
Great. I'm sure it's fascinating whole pile of challenges, right? All these islands and low income and so forth. But that's the, should we go quiet, Dina, whilst you get that people in, and yeah, maybe we get started.
Okay, sure. I'm going to start sharing my screen so everyone knows what we're doing today. Okay, so we're going to start in like 1 minute. Let me see, 1 minute. Okay, so hi, welcome everyone. So, okay, I think I can just start. So welcome everyone to today's panel discussion. We're going to discuss about changing the healthcare paradigm through digital transformation. So in this discussion, we're going to explore what are the elements of the health system in different regions, and also what are the opportunities for system innovation or like digital technologies in making the system to be sustainable and more impactful. So this is how we're going to run the panel discussion today. We're going to have some introduction about the Jakarta Hub and Bangalore Hub. And there's a context setting from Shama about the topic on the health system. And will be followed with the moderated questions from the moderator as well as the Q&A from the audience. Before we start, I'd like to inform you some house rules. Of course, I'd like to ask everyone to mute yourself when you are in the Zoom meeting. If you experience trouble joining the Zoom, please log out and rejoining. If you keep experiencing trouble, please raise your hand and we'll try to solve it technically from our end. And you can actually drop your questions anytime for the panelists on the chat panel. Or if you have any question for us, please also drop your questions on the chat panel. And now I'd like to introduce you about the System Innovation Hub. So as we know that the world is now changing very fast in profound ways, as we used to be working in a disconnected ways, and now we have to be more connected. So the solution that we have can be more sustainable and also more impactful, right? So we need to transform boxes and silos into more connected networks. Therefore, system innovation is a new approach to innovation that tries to tackle complex systemic challenges through the use of system thinking and new technologies. It is a kind of innovation that aims to change the underlying structure of a system rather than just any of its individual parts. So we are an online collaborative platform where thousands of system practitioners exist. We are very passionate about exploring the opportunities of system innovation and system thinking in tackling complex challenges together, as well in building collaboration to do to make real ideas happen, also real projects happen too. So you can join any of the hubs that exist in various countries around the globe. So the new hubs right now are in Jakarta, Sydney, Dubai, Madrid, and Tel Aviv, and more hubs are launching soon this month or in the coming months. Let me introduce you the organizer of this panel discussion, which are first the Bangalore Hub. So the Bangalore Hub started in July 2021 and launched in December 2021. The hub has 58 members and is active on LinkedIn and Twitter. This event is the 5th event since the launch and the second one in collaboration with another hub, which is Jakarta Hub. And Jakarta Hub has just recently started its community activities in June 2022 through learning meetups online. And you are very welcome to join our learning community meetups in the hub and to explore about system innovation knowledge in the platform. Okay, now I'm going to hand over to Shama to share some context of the topic on overview of health system. Now hand it over to you, Shama.
Thank you very much, Dina, and I hope you can hear me clearly. If we can move to the next slide, please. So I wanted to start with this image. I like this one very much currently and talk a lot about it. I think we all know about the blind man and the elephant. There were 5 blind men. Here there are 3 that you can see on this image. And based on what part of the elephant they all touched, they thought it was something else. And I think systems thinking, and which is why the hubs are talking about healthcare and the digital transformation today. But I think for us, systems thinking is about recognizing that the way we think and look at the world determines how we act. And I think we want to set the context by talking about the healthcare system a little bit, and then we'll turn it over to the panelists. Next slide, please. So health systems, just to get us all onto the same page in terms of what is a health system, and I'm using a WHO definition to keep it simple. And I think the health system, that the way WHO defines it, is that it's all organization, all people, and all actions whose primary intent is to keep people healthy and promote, restore, or maintain health. Sorry, did somebody say something?
No, Shama, I think please continue.
Okay, sorry. Yeah, if I can request everyone to please mute yourself, and if you have a question or an issue, please leave it in the chat and we'll respond. So what this means, and I think why this definition, at least to me, is important, is that this is more than what we think about health system. So it's not just the government provided or the publicly owned facilities. It's not just the private sector and the healthcare services that get provided. It's also all of the efforts or the determinants of health, right? Including people. So family members, a mother who takes care of a sick child at home, or a caregiver, a child taking care of aging parents at home, are as much part of the health system. We have a lot of organizations who work on, for example, water and sanitation or behavior change programs. Health insurance is a very much a part of the health system. We have occupational safety. What happens in workplaces to keep people safe is also part of the health system. And of course, the intersectoral action. You're going to hear from some of the panelists today, because the work that happens in poverty reduction is very much contributing to what happens with health. So I think it's important to understand this health systems far more holistically than perhaps many of us think about it. Next slide, please. I think the other piece that I think is important for us when we think of health systems is to differentiate the health system from a disease-specific effort. I think during the pandemic, we've all been focused on COVID and COVID response, and that leads to specific solutions for COVID. But like we've learned with the COVID response, there are many other things, including things that we were doing very easily in the past, like immunization in many countries or many parts of the world, that have sort of fallen to the side. And responses can be quick when we're talking about a disease, as has been with COVID-19. Even if we don't think it's been very quick, it actually has. And they very much depend on how strong existing health systems are. And I think what we've seen is that primary healthcare and care for many things got affected in majority of the countries. It didn't matter whether they were emerging markets or the developed countries. So I think today, just given who we are as the systems innovation hubs, we'd like to focus it from a health system perspective, which means what needs to be different if we're talking about healthcare and digital transformation. What are system level changes? Because that then affects multiple diseases, and actions may take longer, but affect a lot more and probably last longer as well. To sort of wrap up, I'm just going to present two sort of frameworks, I guess. This is about the next slide, please, Dina. We have the WHO 6 building blocks. This is how those in the healthcare system like to talk about health or the health system. And you'll find that there are some things that are common no matter who talks about it. So financing, how we pay for care, and the medical services, the service delivery or the products and diagnostics, etc., is sort of common here. And of course, you have leadership and governance. And then you talk about outcomes and what happens to people in terms of their health, how responsive the system is, etc. Next slide, please. The next one, I hope it's not hard to read, but it's a World Bank or a Harvard Health Systems framework. And they're looking at it from, you'll see financing again, you'll see behaviors here though. And they're talking about these as sort of factors that you have to, these are the things that you sort of control to actually affect intermediate performances and then lead to larger performance, which is around satisfaction, risk, and health status. So these are some ways that, or some examples of how people think about health systems. And with that, I'm going to hand it back over to Dina to get the panel discussion started. Thanks, everyone.
Okay, thank you, Shama, for sharing some overview of the health system that we can start the discussion with. So we're going to start the panel discussion. I'm going to introduce the panelists for this discussion. First of all, there's Andy Wilkins from the UK. Hi, Andy, how are you? Thank you.
I'm good, thanks, and really excited, and it's a great honor to be here. So I'm really looking forward to today.
Yeah, we really appreciate it, and thanks for joining the discussion tonight. So, and we also have Patricia, who is from Indonesia. Hi, Patricia, how are you?
Hello, how are you? And I'm very happy to be here and joining with you guys. I hope we have quite a fruitful and interesting discussions today. Thank you, Dina.
Okay, thank you for joining too, Patricia. And of course, Shama will also be one of the panelists. Hi, Shama. Thanks for sharing the overview earlier.
Thanks very much, Dina. I'm going to switch hats from the Bangalore hub to actually now just being a panelist. So thank you very much.
Okay, so it will be very interesting to, to obtain some insight from the three of you about the health system across the globe, right? So I'd also like to inform the panel, it's like the audience, that the discussion is recorded. So we're going to provide the link to the recording on the hub. So you are welcome to join the hub to access the recording, as well as if you have any question for the panelists, please feel free to drop the question on the chat panel anytime you want, and we are going to answer the questions during the Q&A session, okay? But I think I can start with some questions that I already prepared for the panelists. I'm going to stop sharing my screen first. Okay, so I think the first question that I would like to ask, I think for Andy and Patricia first, okay? How do you describe the top two common elements across health systems? Probably Andy.
Okay, let me go first on this then, and I'm delighted to be part of this conversation because paradigm change and digital transformation in healthcare has been something I've been working on a lot in the last few years. So this is very much to the work I've been doing. So there is a huge stress and challenges across all healthcare systems, and COVID has just exacerbated those. There's huge backlogs, as well as lack of funding and great pressure. So digital transformation is high on the agenda. The former health minister had put digital, preventative, and people as the three top priorities for the UK healthcare system. So you can see how important digital is. But in terms of your question around two key themes around which we can think about digital, I think, first of all, one that you've kind of hinted at already, which is this move from a factory production-based way of healthcare with lots of silos to something much more around integrating healthcare around the person. So how can we go from delivering bits of healthcare in silos to seeing the person and building and orchestrating care around the needs of individuals and communities more holistically. And that sort of breaks down into see the person, not just the disease. So it's about bringing together all aspects of healthcare, whether it be physical or mental and primary and secondary, and saying how, as actors, how can we see the person and orchestrate our actions as a system around that? I think it's also broadening out in the UK to social care as well as just clinical care. So that's looking at people who need support beyond just medical for illness, for infirmity or old age. Bringing in more the family context, so it's people's families and contexts in which they exist, which also are part of the healthcare paradigm we need to be speaking to, and having a different kind of conversation in that. So moving away from what's the matter with you to what matters to you, and bringing the voice of the person in to help us think about what our new system should be doing. It also means another form of that integration is using digital to think about ways in which we can start to think about care being delivered at home or out of the hospital rather than hospital. And COVID has given us an example of how we can start to marshal technology to remotely monitor and support people. So can we do that for other conditions? So rather than bringing people into hospital, support them remotely. I think a big theme as we move forward in the next 10 years is this approach to personalized medicine. So rather than factory production, everyone gets the same, starting to do things like genetic sequencing. So the UK is going to genetically sequence 5 million people to start with, to start to understand their propensity for disease, and also being able to customize particular treatments and drug doses to the particular genomes. That's a really interesting move towards personalizing treatment and care. And also going upstream, I think, of disease symptoms. This is a new and emerging opportunity where new biomarkers are being identified that indicate that diseases have started to take root before you've got any symptoms. So things like blood biopsies, where you can start to see protein molecules and DNA markers for cancer before you've got cancer, bring in the possibility of whole new forms of screening. So these are really kind of exciting areas around which personalized medicine can start to occur. I think finally, very quickly, the second theme would be this whole shift to preventative. We have a national health service, but in reality, it's a national sickness service. So the best way to get on top of rising costs is to help prevent people get sick in the first place. So this whole discussion happening now about well-being, and we can perhaps go into that a little bit more. Is it just the absence of disease, a glass half empty way of thinking about it? Or is it about enabling people to flourish, a glass half full way of thinking about prevention? And there's huge evidence to suggest that people are less likely to get sick and more fully contribute to their society if we can get that right. And then finally, I would say bringing a preventative agenda is challenging healthcare systems to say, where are the boundaries of health? Are we now broadening this out to include a wider ecosystem? So that's around lifestyle stuff. So that's food and food manufacturers, anything to do with exercise, bringing those notions of friendship and connection. The technology industries are playing a greater role in our lives. So how can we work more closely with them? Working more closely down at the community level around local government, creating the contexts in which health and flourishing can occur, and mobilizing community assets to be part of that conversation. And finally, bringing healthcare into education so that people, younger people and older people, can get a better understanding of what's important and how to cultivate and nurture their own and their family health. So I think these are two big themes that of where we can explore a lot further. So lots to talk about.
Okay, so that's very interesting, and especially when you talk about, you know, like bring the health system into the education sector. So that is actually something that I'm working on right now, especially in the changing behavior towards the related to the health system. But I also like to hear from Patricia. What do you think, Patricia? What will be like? How do you describe, you know, the elements of the health system based on your experience?
Okay, this is an easy, looks like an easy question with quite a tough answers to share. But let me try to answer this maybe. maybe the context. I think my context will be Indonesia. Yeah, I'm probably not referring to what's going in the global, even though in the health sector, I think is more or less is the same. The difference is just some countries is, I think, like UK's move way further compared to us. Indonesia and UK, I think the same, have a universal health coverage, but maybe Indonesia now is still at the very beginning stage that we want to be like NHS, for example. Maybe that's some context. So in Indonesia, I think the systems consist of pretty exactly the same what Sharma just shared with us. It's consists of the healthcare, the deliveries of the services, financing, research, and then the health workforce, medical products, management, and police policy and regulation. And also maybe the last one is pretty much a little bit different, is community developments, because in the Indonesia context, because of we have 17,000 islets and 270 million people with living in different stage of development, and then like some areas is actually very minimum in infrastructure, for example. So there are some parts in the health system that is relying on the communities. Like, for example, we have these community services consist of women and mothers that build helps for the health checks for children below 5 years old, and so on and so forth. And then with the universal health coverage in Indonesia started 2014, we have several challenges differently. I share a bit before, saying that both from supply side and demand side, we have issues with the changing communities, peoples, and then information, how we got information, and so on and so forth. The universal health coverage have a problems with the supply side. We have an unequal distributions of health facilities, health workers, and doctors, so on and so forth. And then we also have questions about prevention issues, because when we talk about health systems or health sectors, we always, or majority people will think about the curative sides, but never thinking about the prevention sides. And the prevention side is actually contributes to the pressures of the health financings in the systems. Like what we see in the pandemic, like less people knows what to do and have less information about health, then the cost of the burden of the system will be increasing. I think these are the situation. And if the question is what is two most important, I think it's pretty much it's quite complicated, because the 6 elements of the health sectors are actually quite related to another. Definitely research is important, but how to say it, in Indonesia context, maybe like resources, workforce is also important. So I think these 2 elements, I think if I may answer the questions from Dina, the 2 elements I think are these 2. Thank you. Give back to Dina.
Okay, thank you, Patricia. Thank you for sharing your thought, especially knowing the health system in the emerging markets. Probably, Sharma, would you like to share some of your experience, considering that India is also an emerging markets, right? So how do you see the 2 elements important in the health system in India, for example?
Thanks, Dina. I think not just in India, definitely India, but I think in some of the other LMICs, and I will restrict my sort of comments to what I've seen in LMICs, and they may be common in other countries as well. But I think the 2 common elements of current health systems, and Andy covered some of this, I think is a very supply side focus, right? We're coming from the viewpoint of a provider. So it's heavily clinical. It is about sickness, diagnosis and treatment, and it is about facilities and infrastructure. I think the second challenge is that we don't look at, again, to a point that Andy made, health is way beyond sort of health departments often, who are focused on diagnosis and treatment and care provision and facilities. because we know that a large chunk of the problems in health, for example, come from the larger ecosystem, right? Sanitation, air, water, food are sort of the building blocks of what keeps us healthy, but are outside of the health department. And most of these, at least in the public sector, don't talk with each other, not in countries like India and in other elements, ISCs as well, right? So I think these are two common things right across. And then the private sector comes in and fills these gaps in their own way. So we have a lot of fragmented services and programs, and I find these are sort of common things across many of the LMICs. Back to you, Dina.
So thank you, Shama, for your thought. Okay, so I have one more question before we move forward to the Q&A, like getting questions from the audience. Based on what you think the top elements of the healthcare or like the health system, what do you see the opportunities for system innovation to make the health system to be more sustainable, especially in the emerging markets, or in your experience, if you can give an example? Would like to start first. Probably I can ask Andy first again.
Okay, thank you very much, Dina. Well, there's an interesting change in thinking happening in the UK National Health Service. As you know, it's a publicly provided healthcare service, the first one I think in the world, but it's under pressure. And a lot of the thinking around how to improve the effectiveness and efficiency of the healthcare service over the last 10 or 15 years has been this idea of maybe we need to privatize more of it. Maybe we just need to deliver things more efficiently and effectively. But there's a kind of conscious realization at the moment that actually better health outcomes don't come from making the silos work better. It comes from coordinating and collaborating across silos to this theme of more personalized, joined up care for individuals. So what we've got in the UK is a really interesting experiment just about to set off in the next month, which is the country is being split into 42 regions for the delivery of healthcare, recognizing that each individual part of the country, be it more a city or a rural area, has different types of healthcare challenges. So what's happening is there's a delegation from the center to these 42 regions to create their own local health plans, which will bring together primary care, mental health, secondary care, social care under one umbrella, such that resources can be allocated to the ones that have most impact in the provision of better health for local environments. And within those healthcare system, integrated care systems they're called, is integrated care partnerships, where they're being asked to set up partnerships with charities, with local governments, with community groups, such that local conversation, a local ecosystem can be built to provide more holistic orchestration of care for the needs of particular communities. And I think this is a really interesting attempt to think and act differently in a more systemic way, recognizing that local communities have very different types of healthcare needs, and that the health system needs to be delegated enough to be able to shape itself to the particular needs of particular environments. So out of that will come a lot of standardization of healthcare records and the ability through greater use of data to see what's going on across this landscape, from cells to cities and everything in between, which will allow some attempt to see and model what's going on for better risk stratification, is a term that a lot of people use. So we can start to see where should we be deploying which resources and where would better partnerships and collaboration be most effective. So we'll see over the next few years whether this localized holistic health ecosystem hub model is going to provide a step increase in healthcare outcomes. And of course, digital and data is key to that thinking.
Okay, so very interesting, especially when you said like delegating the health system to be more on the local, on the more local and holistic, especially in getting the data and stuff. But then I would also like to hear from Patricia. So what do you think, Patricia? What will be the opportunity for system innovation to make the health system be more sustainable, especially in the emerging markets?
Yeah, I agree with what Andy just explained. I think that's also the opportunity for people in the emerging markets. Like for example, in Indonesia, we probably have like 70,000 like community centers for health that arranged by the government and the community, and there is no informations between them. Like for example, if we live in one area, actually the health centers in that area should have known the populations within those areas and all the data and informations about all the individuals. So we have like sort of like informations, data, and mapping about what's going on in the area and what kind of prevention effort that we can do or we can give to the populations in that particular area. I think these are the informations that at the moment, the government of Indonesia, for example, is trying to develop, trying to sort of like reform. So in the government, within the ministries, there is an ad hoc team that call it the Digital Transformations Office, that trying to digitize all the informations within the health systems, from the financing aspect all the way until the target is that they have holistic data about the whole the health systems. So this another sides like the communities development, the effort from the small groups, I think quite scattered here and there, and I think there are a lot of possibilities and to sort of like manage them into one collaborations with the local government or the communities health systems. Because like for example, there are some groups of doctors from psychiatrists from for example in Indonesia, they have this activity to provide sessions for therapies and all that, and then especially during the pandemic where there are a lot of tensions, like the mental issues, and they have this kind of hub that opened it, and this is non-government. They're not funded by the government, so this is just a community groups that started initiate this kind of activity. So there are quite a lot of opportunities for the health sectors, especially. Another one is the education part, because I think with the technology nowadays, people can get a lot of information from everywhere, every day, and they need to get the right informations. Like what we see in the pandemic, the past 2 years, the war between which one is hoax, which one is true, which one is how are they going to respond with the situations. It looks like we need, and there are a big opportunity where educations can be shared better within the society.
Okay, so thank you, Patricia. It seems that the system innovation, or even like the digital transformation can accelerate the collection of information, so we get insight much faster, so we can prevent diseases much faster as well. So what do you think, Shama? What do you think would be the opportunity for system innovation to make the health system more sustainable?
So just adding on, I think both Patricia and Andy made some great points. And from where I am, I think I'm just going to talk about, say, 3 opportunities, right? I think the first one is just around the shift towards primary healthcare. This has been a long time coming, but I really feel like post-pandemic, there was I think movement pre-pandemic, but I think post-pandemic it's really gotten accelerated towards primary healthcare. And I think a lot of us, even in the public health space, confuse primary care with primary healthcare. But I think that's getting far more clearer, and that focus is the opportunity. So when Andy was talking about earlier on the wider notion of health and food systems and shifting to well-being, I think a lot of that is coming from the work or the push that's happening, not just, to me at least, not just by public and let's say market forces, but by a lot of innovators and community organizations and nonprofits that are coming at this saying, how do we actually shift the paradigm, shift the narratives around this, right? I think there's a lot of innovation happening there, and a shift towards system innovation is possible. There, I can talk about examples, at least in India, we're trying to put them all together so that we can learn from what's happening just within the country itself. Giving you an example, in India, what we've seen is in 2019, it was launched, and the work has started in 2020 and 2021, a little slow, but nonetheless, I think we're making progress, is the whole National Digital Health Blueprint. So rather than look at something that's top down and launched in terms of a digital ecosystem, it's really being co-created with a lot of people in the country to try and, just like our financial systems today now, probably exceed or in terms of technology and what we're capable of, many of us sort of function cashlessly today. That kind of tech enablement has been possible very rapidly in 5 years, right? So how do we try and replicate some of that processes in terms of the health technology itself, and creating these backbones where if you are anywhere in the system, private, public, nonprofit, at any level of care, how can you integrate and share? And those protocols are being put together. So I think from just a digital perspective, there is thinking that's happened, and it will evolve. We're in the early years of that work that's happening, but right from consent to claims to all aspects of technology and interactions within the health system, at least. It's yet to get into the larger ecosystem, but at least within sort of the healthcare delivery vertical that's coming in, I think it's a huge step for us. So that experiment or that work is currently underway. I think coming back to a point that Andy made earlier, I think integrated primary care, again, is something that, at least anchored locally, is something that we started back, I think in India in 2013, 2014. We actually have a policy that, at least in urban communities, it has to be community-led sort of societies that anchor this. Now, the implementation of that has been slow, but I think we have a lot of experiments now happening to say, how do we strengthen that? How do we get communities to anchor that and work with all providers, whether they're private, public, diagnostics, what have you, right? Including preventive services. And like we were saying earlier, one size does not fit all. And unless people themselves sort of take charge of that, not just in terms of managing it, but also what is needed in terms of prevention, and keeping people healthy, right? I think that is a shift that's possible if we bring people back into the conversation. And that's the other shift that we're starting to see. And I think there's huge scope in terms of system innovation there.
Okay, so thank you, Shama. A very interesting insight too. I learned a lot from the three of you. It's very, very interesting conversation. So I think I see a lot of questions started coming in from the audience. We're going to start the Q&A session. I'm going to hand over to Prasanna to moderate the Q&A session. Over to you, Prasanna.
Thank you, Dina, and thank you everyone for the questions that have come in, and thank you to the panelists as well for discussing some of the the initial questions that Dina brought in. I'd like to probably highlight this question among the others that I've received, and we'll try to take in all of them. So this one is from Janine, and it is, how could big healthcare companies support the holistic healthcare paradigm that we want to achieve? And can we also speak about how do you envision the collaboration between companies, governments, payers, other stakeholders, basically, that includes academia? So can I ask this question to start off with Andy, and then other panelists, please feel free to add in. Over to you, Andy.
Thank you, Prasanna, and it's a fabulous question. It's a $1 million question. I'll answer it in a couple of ways. I think, first of all, I've been doing a lot of work in this space, and one of the things, just to talk about digital transformation in and of itself, you can almost boil it down to two ways of thinking about digital transformation. One is thinking about it in a very practical, low-level way, which is how do we digitize the stuff that we currently do? So how do we take our forms and make them digital? So it's simply taking the legacy way of doing things and putting it onto a digital platform. And there are certainly opportunities to save money and do things quicker that way. The far more exciting way of thinking about this is how can we reimagine healthcare in a digital world? Because digital gives us a whole bunch of new capabilities and new data, new insights that we never had before, the ability to share data across different silos that could never talk to each other before. So digital creates this sort of landscape, this plane that allows things to come together and be reimagined in radically different ways. And part of the great challenge of healthcare transformation is that we don't fall into version 1, where we just digitize all that we've done and just hard code into our healthcare systems all the legacy practice, but we've now built that into digital. The challenge we've really got is to open the mind to reimagine healthcare in a digital world and open up new conversations, new forms of thinking of how can we solve healthcare challenges with the resources that we got from the legacy world, with these new ones from the digital world, and what can arise out of that. And what I've found is that that's very difficult to do, because every silo has got its own targets, every business has its own shareholders, everyone wants to hit the quarterly numbers, and people's imagination suddenly crunches down into how do I hit the numbers, how do I hit the numbers? And these kind of conversations for reimagining become really difficult to do because they sidetrack us from hitting our numbers. So what I've found is super important, and it's been work I've been involved in the UK, is that there needs to be a systemic vision for what healthcare in a technology-enabled 21st century can look like. Is there a shared vision around which all parts of the health ecosystem can see where we're heading towards and what part they may play in it? Because if we have a shared vision that can enthuse and excite the entire ecosystem, it opens up a space for these new conversations about how we can come together and partner in new ways to deliver this new kind of future. So I've been personally involved in a lot of work looking at what a vision of a 21st century technology-enabled, person-centered healthcare system might look like. If anyone's interested, you can have the report for free, but it's being used in the NHS. It's being used as a framework to open up conversations between different actors that otherwise would be really difficult to do because they're just focusing on their own P&L. So I think I'll stop there, but having a shared vision, I think, is a super important part of opening up the space for new forms of partnership in this digital world.
Thank you so much, Andy. I think it's almost a follow-up question, with regard to that, is actually JV. I don't have the full name, but it says, how do we get healthcare services to think beyond what they have always done? That is, we can think more efficiently. We have more FTEs and things like that, which I think touches a little bit upon the mindset that you talked about, new ways of thinking, and also the systemic vision, which is necessary, across all these stakeholders to have a common shared vision. And so, but I think in that interest, JV, I think I will pass on to the next question that I would like to, before that, if I may, any other panelists, would you like to add on to what Andy has just said first?
Just one thing or one thought would be that, I think digital and tech sort of becomes like the hammer, and then you're looking for the nail, right? And I think that's what we need to stop doing. And to Andy's point, what is the vision? And if we are talking about keeping people healthy, how do we think differently about using the appropriate kind of technology to the appropriate context, right? I think sometimes just a phone call is actually more appropriate than perhaps, an application or something else, right? A point of care test may be more appropriate. So I think we can't, digital and tech need not necessarily be AI. I think what is most appropriate for what context and for the care that we intend and the quality that we intend, I think that becomes very, very important. And being able to distinguish that, I think, sometimes gets forgotten. And in the context of systems and innovation, I think it's not just about the product innovation, because there's a lot of that happening when it comes to technology, right? Or we have the latest this, that, or the other. But I think we're talking about whole systems and how we shift that. And I think for that, we do need to think about technology differently.
I think I would just add to that very, very important point that, you know, what I was talking about is a shared vision at almost the strategic level, but it's a combination of top down and bottom up, and having the courage to experiment, because we need to run experiments at the front end of healthcare, which involve new ways of doing things, partnering in new ways to try something out. So creating an environment where people are encouraged to innovate and explore and create experiments that we can learn from, and then distribute that learning across the system. So we both have a sense of the shared direction that gives us the rationale for why we should be doing things differently, and then the opportunity to run these experiments locally to understand what works, extrapolate the learnings and share that across the system. Now, all of this is super hard. It's not easy at all. It's not for the faint-hearted. But it's essential that we get better at doing this, which is why this systems thinking is such an integral part of how we go about thinking about this digital transformation journey in healthcare.
Patricia, would you like to answer? Patricia, can you hear us? Would you like to answer?
Sorry, the sound is on and off. Can you repeat the question? Sorry.
Yes, sure. So this was going back to Janine's question: how could big healthcare companies support the holistic healthcare paradigm that we want to achieve, and how do we envision the collaboration between the various stakeholders, such as companies, governments, taxpayers, academia, and so forth?
Okay, yeah, I think that's the ideal, but yeah, I think Andy also mentioned before that each party, I think, have different interests and somehow, and I think the biggest challenges is to put their interests on the same page, and it takes a lot of I think what do you call it, like rules and regulations, of course, definitely to make it an Apple environment for such a collaborations, because it's how do you say it, medical, the health sector is, as long as it's not too clinical, I think it's way easier to have these collaborations. But say if we're talking about the social dimensions of a health, but when it comes to the more clinical, when we deal with medications, with the pharmaceuticals industries, and I think this will be like quite a highly regulated environment where collaboration and so on and so forth. There are a lot of rules in that, but it's very it's very ideal to have this kind of the collaborations within all parties, because to achieve the objective of the health itself is, I think, this collaboration is definitely necessary. You know, the objective of the countries and also all that. So I think that's my part, my answers.
Thank you, Patricia. In the interest of time, I'd actually like to move on to another question, and this one is from Dushan. The question is, as you're aware, healthcare providers are conservative and slow to adopt change. How do we help healthcare providers to adopt, digital transformation? So may I probably pass on this to Patricia, and could you start, and then the other panelists could follow on.
Maybe I can take a first stab at that, Prasanna. Patricia, if and Prasanna, you may want to post the question in the chat as well, just so that those who haven't been able to hear you can pick it up. I'm not sure if you're talking about healthcare providers, such as doctors or clinical establishments, if that's what you mean, Dushan, in terms of I find that a lot, right? No matter, I have very, very good friends who are clinicians and who will talk about the need for technology in the space, but when it comes to necessarily doing everything that they can, we do face resistance, right? One of the classic ones that I worked on over the last few years is what is called clinical decision support. There's a lot of work that's been done everywhere on clinical decision support, but try and get clinicians to use it. They will always tell you it's the frontline workers, it's the nurses, and it's everybody else who should use it. But if you try and force a doctor to use it, you're going to get resistance. I think that is behavior that we know of, right? So I think, can we force people to move in that direction? It's not going to happen unless the whole system's going to shift, right? I think if you look 20 years ago or 30 years ago, it wasn't that easy to see computers in a lot of the hospitals. I don't think 30 years ago in India, we could have thought of something called the National Digital Health blueprint or an ecosystem. But when ecosystems move in that direction, the kind of, I mean, just look at the pandemic. We had rapid antigen tests that became available and in homes very quickly, right? Telemedicine got picked up. It's been a lifeline for many during these times. I think we're seeing that there is going to be a shift and things will move, whether some people like it or not. There are going to be early adopters, those who will push it, and there are going to be people who struggle, and eventually if you don't get with it, you will lose out. And I think when the system shifts, eventually you're going to be able to do that. I'm not sure that we'll be able to convince everyone to say this is the right way to do it. I do see a lot of technology adoption at the front lines. People who we typically think are going to struggle with phones or whatever else, there's a hunger because it gives you the results. So I think when there is a willingness and an opportunity, you see the opportunity to deliver something, the transformation happens or the transition can happen. But we just have to accept that there are going to be people who are going to resist that. And that's sort of not unusual for change. So.
Thank you, Shama. Andy, would you like to go next?
Yeah. I would echo a lot of what Shama said. I think very, very wise observations, and there is a lot of attempts to introduce technology into the British NHS service, but there is a joke going around the NHS that the NHS has more pilots than British Airways, that there are just so many pilots that don't go anywhere, which is super frustrating for the digital health companies. But secondly, often the digital health innovation, which is very clever, gets adopted into a legacy way of doing things. And most of the benefits of the new technology get cut off as it's force fit into the old ways of doing things. So, and then you've got the additional challenge that if this adds cost to the care pathway, even if it's a better way of doing things, then there's a resistance to that as well. So I think one of the challenges about introducing technology into the healthcare system is that if you take it too small, then either it gets co-opted into the old model or it hasn't got enough visibility to grow. If you try and change too much, there's too much resistance in there. So it's finding what scale of transformation is going to give you the best case study. And it's really looking at things as care pathways rather than bits of functionality. How can we change a way in which a piece of healthcare is delivered? Because if we can improve the outcomes, lower the costs, and show a return on health and cost, then healthcare systems will tend to be attracted towards that kind of innovation. But we've got to think of the multiple benefits that will lead to the healthcare system wanting to adopt it. And it's partly taking out costs, making things easier, and delivering better health outcomes. So we've got to be very clever about how we design where our transformations land and what kind of experiments we run. I think finally I would add it's super important that the CEOs and the board members of the healthcare institutions are fully bought into this, so that they can create the culture and the permissions to do these kind of experiments, that they show interest in it, and in doing so elevate the importance of these kinds of transformations to the rest of the organization, so that that conservativeness and that resistance to change can be dissolved over time. But so it's going to need a combination of correct positioning around the innovation and the senior management support for this kind of experimentation?
Thank you, Andy. I would also like to introduce a new question here in the interest of time, if I may. So this is from Jari, and Jari's question goes like this. How do we attract talent, finance and such teams in actual healthcare organizations and build tailor-made solutions that support and work around an individual. So basically to be able to use AI, he says we need a lot of data, and that needs to be created somehow. If I may to summarize the question, he also goes on to ask, should we say we need alignment together with once only principle? So I hope that question is clear, but if not, I'm happy to repeat.
Hello?
Yes, Dina. I'm just, yeah, no, I wanting to see if Patricia wants to come in on that question, or Andy, if you want to go first.
Okay, so I repost the questions on the chat panel if you want to read first, Patricia, or if you are keen to answer it. Question from Jari. Hello, Patricia.
And Dina, if you want to take that on chat.
Okay, sure.
Andy, do you want to go first if you'd like to respond to that?
I don't fully understand the question, but I'll address the one of AI. There's a couple of things I will say there. One is health is and will become, as we undergo this digital transformation journey, one of the most data-rich environments in the world. And therefore, the opportunity to apply the latest thinking in machine learning and AI, in theory, is super exciting. It's filled with some challenges, though. We've got lots of legacy bits of data, lots of fragmented pieces. So can we actually see and model the area that we want to be able to apply machine learning and AI in? So there's a really important piece about ensuring we've got the right data environment with accurate data that's able to be shared across the environment in which we want to deploy the machine learning and AI. There are some amazing free tools out there from the healthcare, from the technology providers, which means this instinct to have to go outside the organization for machine learning and AI is not necessarily the case. And we've got within the NHS an attempt to bring a number of data science people into the healthcare system and provide training opportunities such that people inside the organization can start to use these tools to model more effectively using machine learning and AI, better ways of seeing how we deliver healthcare. And you can think of this broadly as two categories. One, how do we orchestrate the function and the delivery of healthcare, which is an opportunity for health organizations to use their own resources to get much better at learning how they function, what works, what doesn't, and become a learning organization. There are, of course, machine learning and AI being deployed in the actual treatment as well. So there's lots of, as we've all seen in the press, through better scanning, better interpretation of health and diagnostic data. So in the actual delivery of healthcare as well, there's opportunities for machine learning and AI. But ensuring, I mean, one thing that I've been advocating really as an important strategic imperative for all healthcare institutions is not to think of data transformation and AI as and data as some kind of back office function. AI is super strategic, and almost every healthcare system needs to have a data strategy that is super strategic, because in the future, machine learning and AI will enable us provide us with tools of great power of insight, but only if we've put the right data into the right environment with the right security and privacy protocols. Will we be able to leverage the power of that? And we need to do that in a structured and designed way, not let data appear in a higgledy-piggledy manner through streaming off the back of all sorts of IT infrastructure that's put in without any strategic consideration. Data and AI needs to be a core strategy.
Thank you, Andy. I'd just like to add a little bit to what you shared just from my experience working on AI and ML. I think this also probably somebody answered this, I'm not sure who, but they did bring up the point of, we will need healthcare technologies to come under global standard regulations so that it facilitates exchange of data. So for example, in case of financial markets, again, I'm taking the reference, we have something called financial markup language, which helps to exchange data between regulatory systems, between the central bank and so many other entities. The same way, we will need something similar to facilitate that. In the US, I think we have something like HIPPA, and whereas in case of, another example would be GDPR. I think this was probably mentioned by Dushan in the chat, but I think this is also very relevant. And this facilitates the exchange of data, probably, including taking care of privacy, other protocols, similar challenges that we are faced with. If I may move on to the next question. So this one is from Alok, and Alok refers to drug dropouts is a significant issue in both prevention and treatment domains. Can you share or comment examples of systemic solutions, including digital, that have attempted to address these? Dropouts is a significant issue in both prevention and treatment domains. Any systemic?
I can take that. Sorry, I can take that, Prasanna. Alok, I'll give you an example from India. We've seen tuberculosis treatment adherence. We have the largest burden of TB in the world in India, and increasing drug adherence for TB is an important outcome. We've seen something like on the drugs that are dispensed, there's actually a number, and that number is visible only once you pop the pill, right? And then you give a missed call to that number. That's the simple technology intervention. And just that has allowed, instead of having people come in every day to take their TB drugs, which used to be the regimen before, you can actually give a week or 2 weeks of supply to people. When they take their medications, there's a number they call, and something like that has actually improved drug adherence here in India. So there are definitely examples of how you can do it. We've seen family-based healthcare support improve drug adherence, right? Counseling is a very, very low cost support that can be provided. Simple things like anemia, which is iron folic acid supplementation, again, a common problem in India, but a lot of people don't take it because it leads to constipation, etc. So you have, within a couple of weeks, people stop taking it and don't solve the problem. So it's not just about tech. I think, how do we bring tech plus what actually works together to try and solve a problem? And it is possible to do that.
I think you're absolutely right there, Shyama. I just add that, yeah, that there are technology solutions around reminder services and the ability to dispense pills in blister packs that have them all joined up. And there's lots of small innovations that can make taking pills easier, reminding people about them. But I think also from the work I've been involved in at looking at how people internalize their own disease. People can become very passive or resentful of their disease, and taking the pill is a reminder of the very thing that they don't want to think about. So helping people more holistically and more humanely understand the nature of their condition and what would be beneficial for them if they were to take a more positive view around their own management of their own condition. So that takes into account what sorts of things are important to me, what that I want to keep doing, that I need to do to look after myself, of which taking the pills is simply part of a bigger journey of making the most of my life and improving my life as much as I can with this condition. So it's almost like a psychological coaching extension to just pill taking that I think could be, has been shown in certain circumstances to be really, really powerful.
Thank you, Andy. I think in the interest of time, I believe most questions have been answered. If not, we will try to definitely share in the coming post the event. So if I may, now I would like to hand over to Dina.
Okay, so thank you, Prashana. I'm going to share my screen again. So I think we have a very interesting conversation in this panel discussion. So I hope that it doesn't end just here. So we can bring forward all this conversation or like unanswered questions in the hub, and we can start the conversation there if possible, or we can proceed with with another panel discussion with like more interesting topics deriving from this. But I'd like to share some highlights that I actually note a lot, but there are like two things that I found very interesting. First of all, when we talk about the digital transformation or like, also like system innovation for the health system to be more sustainable is in being the platform where we want to delegate the health system in a more localized and holistic way. So the collaboration can take place, and also like a new conversation around like how the health system should work will be more possible to do. As well, I learned that the digital transformation can accelerate the effort of disease prevention, so we can make sure that people are healthy through this digital transformation effort. So again, everyone, thank you for dropping out your question on the chat panel. And also I'd like to thank all the panelists. Thank you, Andy. Thank you, Patricia. Also, thank you, Shama, for sharing a very interesting insight. We're going to bring all this conversation into the hub. And if you wonder if you can access the recording, you can access the recording into the hub. I mean, like from the hub. We have our System Innovation Network hub here. There are 3 main activities that we do in the hub, where you get connected to the other system practitioners there. We learn together about system thinking and system innovation. We also connect with people, collaborate together, and exchange ideas. And also we do co-creation activities to solve real complex problems with, with some solution that might be possible. And here, if you are interested to join the hub, you can basically, here, I will share the, so you can join from the link that is going to be posted in the chat panel. I'm going to ask my team to, or like Jakarta team, to post in the chat panel. You can click there. And again, thank you everyone for joining. I hope to see you again in the next panel discussion. Okay, you have a great day, or you have a good night.
Thank you. Bye-bye.
Thank you. Thank you, Patricia. Thank you, Andy. So we really appreciate it.
Thank you, everyone.
Thank you very much for a fantastic conversation.
Thank you, Andy. Really enjoyed it.
Yeah, me too. Thank you, Shama.
So I'm going to